Hi everyone, I'm student Dr. Jonathon Heath Hines, and I'm a second-year medical student at Sam Houston State University College of Osteopathic Medicine. I'd like to discuss the roles that geographic disparities play in asthma hospitalizations, specifically looking at race and ethnicity, socioeconomic status, and other factors, particularly in Lubbock County, Texas. For those that don't know where Lubbock, Texas is, it's the home of Texas Tech University, where my colleagues were located at the inception of this research in 2018, prior to COVID, which did not impact the study. This isolated county in West Texas is medically underserved and home to a population of approximately 310,000 people. The limitation of this longitudinal study is the change in population in the Northwest region due to changing student populations of Texas Tech over the years. We took Lubbock County and split it into 4 geographical regions based on zip codes to get a snapshot of the different areas before looking at any differences in population, racial diversity, socioeconomic status, etc. It's important to note that nearly all the hospitals and clinics for Lubbock County are located in the Northwest and Southwest regions. In the United States, asthma is a chronic disease that most people have heard of and know someone that is affected by it. Asthma affects children commonly and is known to affect 1 in 10 school-age children. Asthma is also known to have the highest prevalence among African American populations and costs the United States approximately $82 billion annually, making it a high socioeconomic burden of disease in our country and accounts for thousands of deaths annually. The Texas Inpatient Public Use Data File is an online database made publicly available by the Texas Department of State Health starting in 1999. Manual data extraction was used to pull relevant info from this database for the purpose of this research. Due to the de-identification of patient records for privacy reasons, health insurance was used as a proxy for socioeconomic status. The public use data file codes age into 22 different groups, so we decided to take these groups and condense them into 5 ranges from 1 to 17, 18 to 29, 30 to 64, and 65 years and older. You can see that the Lubbock demographics are mostly a white and Hispanic population, with 53% being white and the lowest being black at 8%. And during this time span from 99 to 2018, there were 4,224 cases classified as severe asthma by the Texas Department of State Health, which considered emergency hospitalizations. As we dive into the data, the Southwest region had the most cases of severe asthma at 51.9%. But once we look deeper with the population adjusted percentages, the Northwest region was the most affected, with 2.5 of every 1,000 diagnoses of severe asthma coming from their population. The percentage of patients using tobacco was pretty even across all regions and is unlikely to be a factor related to disparities. As we have already discussed, asthma has a high prevalence in young patient populations. Our research supported this notion as over half of the severe asthma cases for this 20-year span occurred in those under 18. If you look at the race of the patient populations, whites experience the highest percentage of severe asthma hospitalizations. Once you account for the percent of the county population, as shown in the brackets next to these values in the table, you can see that blacks and Hispanics are actually disproportionately affected, and blacks account for over half of the severe asthma cases in the Northeast region during this 20-year span. Federal insurance, represented as Medicaid and Medicare, was used as a proxy for socioeconomic status due to the de-identification of patient records. Of those with severe asthma, 32.8% have federal insurance, and in the Northeast region that was even higher at 43.3% holding federal insurance. The Northeast region is known to have the highest proportion of residents of low socioeconomic status in Lubbock County, and was observed to have the highest odds of these residents being hospitalized with severe asthma. Another item is particulate matter, which was unable to be parceled out by region for this study, but it is known to be to have an association with asthma, and the concrete batches in the Northeast region are likely to make them the most likely to be exposed to particulate matter, causing exacerbations. The importance of this study is to show that there are geographic disparities, socioeconomic disparities, and more that are influencing patient care and disease processes. Thank you.